Marta has been encouraging our workforce to receive their COVID-19 vaccination for several months and is now working towards ensuring all of its people are fully vaccinated. This is the responsible course of action for Queensland's largest not-for-profit healthcare provider to take to protect people who work in its hospitals. We know healthcare workers are at high risk of COVID-19 transmission by the nature of the work we perform, and we know vaccination is the best form of defence. I realise that some of you, however, may have questions or concerns about vaccination, and I'm hoping I can address some of your issues today. Let's begin with the basic question of why you should be vaccinated. The reason vaccination is so important for everyone here in Queensland is it's clear we've had great results with the strategies we've employed so far, but that hasn't meant the virus has been eradicated. It's going to keep coming. And eventually, might not be this week or next week, eventually the virus will come. And if we're not ready, if we don't have as many people protected as possible, well then we'll see the severe consequences that come with having lots of cases of this virus. That's why it's so important that everybody, particularly people who work in the healthcare environment, get vaccinated. Some people believe, or have been told, they have a medical condition that prevents them from having a vaccine, or that a COVID-19 vaccination will exacerbate their illness. Well, fortunately, basically, there are very few medical conditions that have an impact on whether you can receive this vaccine. And now we're in a very fortunate position to have 3 vaccine options available in Australia. So it's almost certainly the case that if someone has a contraindication to one of the vaccines, that there'll be another one that'll be appropriate. Of course, I encourage people to discuss with their GP, specialist or vaccine provider, but I'm very confident there'll be very few people that actually have a genuine medical exemption from receiving these vaccines that have proven safe and very effective in both large clinical trials and extensive real-world experience. So let's ask ourselves, what would happen if you don't get vaccinated? Well, every person who's unvaccinated is susceptible to this infection, both from getting infected and passing it on, but also to the significant consequences that follow a very significant proportion of infections with this virus. Why does MARTA require all staff to be vaccinated rather than just those dealing with COVID patients? Well, we know every person who's not vaccinated remains highly susceptible to this very infectious virus. And when the case arises that we have lots of cases around, we don't want any of our staff to be susceptible. We need to continue to be able to do the good work that we do. Now, if we have lots of our staff infected, well then we may not be able to do that. And they may also transmit to other critical members of the organisation such that we can't continue the critical work that we do. So why are we focusing so much on vaccination right now? Well, it's been clear that our strategy of trying to keep the virus out has put us in a relatively good position for now. I think everyone acknowledges the fact that this virus hasn't gone away. It's going to keep coming and we can't keep it out forever. And when it does come, we need as many people protected as possible to limit the number of cases and, most importantly, the amount of severe disease and the impact on our healthcare system. We certainly don't want to see our healthcare system overwhelmed with sick people from COVID, and we can prevent that by having enough people vaccinated. The targets of 70% or even 80% are amazing and will put us in a really good position, but basically the more people vaccinated, the better. Finally, there's been a lot of controversy recently about the Pfizer vaccine for people over the age of 60 and whether it's appropriate to have one dose of Pfizer and another of AstraZeneca. Well, here's what you need to know. I mean, at the moment, we have both highly effective, very safe vaccines in Pfizer, AstraZeneca, and also now Moderna, and we're definitely wanting to use those in accordance with how they're initially approved, which is that you have one dose and then a second dose of the same vaccine. It's likely into the future we might swap over for boosters, but certainly right now we're not doing that. And as we're using these vaccines, they've been proven very safe and highly effective. Hopefully this information has helped address any concerns you may have or questions you wanted answered. Vaccination is the only way our community can reduce the spread and severity of COVID-19 and its new variants. As healthcare workers, we are not only at highest risk of getting COVID-19, but we also have a duty of care to keep our patients safe. The solution is simple. Get vaccinated today.